The following segment is sponsored by UnitedHealthcare.
Open enrollment season is here, the time millions choose their health care coverage for the next year. But a recent survey shows that 43% regret decisions made by misleading information, and 1 in 5 were influenced by online creators without medical credentials. Joining us to help sort through the noise is Dr. Rhonda Randall from UnitedHealthcare. Welcome to the show, Doctor.
Thank you for having me.
We are so glad to have you. Now, let's start with the basics. What is open enrollment, and why is it so important for people to pay attention to those deadlines?
Well, open enrollment season is here. This is a time of year when millions of Americans select their health care benefits for the year ahead. And that open enrollment period isn't the same for everyone, so you're going to want to pay attention to some important dates. For Medicare beneficiaries, your open enrollment period begins on October the 15th and runs through December the 7th. You're one of the millions of Americans who get your health care benefits from an employer-sponsored plan. You generally are going to have a 2 to 3 week period sometime between now and the end of the year. Watch for those employer communications. And for individuals shopping for a plan on the health insurance marketplace, your enrollment period runs from November 1st through January 15th in most states.
And you definitely don't want to miss those. With so much misleading information out there, what should people keep in mind when they're making their decision this year?
Well, there's a lot of information out there online and in social media, but it's important to recognize that it's not all accurate. So start by checking the source. You want to look for a source that has credentials, that is credible, that is a reputable organization. For example, watch for those red flags. If something sounds too good to be true, it's causing fear, or there's a miracle cure, that's something that should be a red flag for you. Always get your healthcare advice from your personal physician. And if you're looking for a primary care physician, for example, your health plan can be a great resource to help you find a credentialed physician.
Great ideas there. What are some of the tips that you recommend when somebody's choosing the right health care plan?
Well, like we're doing right now, start early. You want to gather the information so to make the best possible choice for you. Recognize that plans can change from year to year. Even a plan that you have today might have changes in the medications that are covered, for example. So you want to compare those plan benefits, the services, and the costs. You want to understand healthcare terms. A lot of people say those things can be confusing. So just plainclear.com, and for Medicare beneficiaries, MedicareMadeClear.com are great resources of that information.
And
prioritize your mental health and look at those benefits as well.
Absolutely. And everybody wants to save money, of course. What are some tips for us to look to not just going beyond those premiums, but to save money in our plan as well?
Yeah, in addition to premiums, look at things like deductibles, co-pays, and coinsurance. Check to see that your doctor and your medications are covered by the plan. See if there's any rewards you can get for making healthy choices, and look at additional benefits, things like dental, vision, and hearing, and other things that can cause you convenience and help you navigate your care easier, like digital tools and 24/7 telehealth visits.
Such great tips. All the information is on your screen. Thank you so much for joining us today.
Thank you. Be well.